Over the years, MS TeamWorks has shared different perspectives on MS from patients, care partners, family members, and healthcare professionals. Guided by our mantra, I have MS, I have a team, I have a future, we are proud to share new messages of hope and inspiration with the MS community.
I have MS.
I'm on your team.
I have a future.
Cheryl Blashchuk. I'm a nurse practitioner in Milwaukee, Wisconsin, and I've been in MS care for about 19 years as an advanced practice nurse. My personal connection is that my spouse has multiple sclerosis and has since 1972. Everybody asks me if I started out seeing him as a patient, or how did I know, or was this my goal? And I always say, it all just came together, and that's good. So hopefully my skill as advanced practice can be carried over a little bit more in terms of my personal life. I think one of the biggest things for patients and their care partners is the unpredictability of multiple sclerosis, the fact that their roles change. Oftentimes they can be temporary changes in roles in partnerships or permanent changes. Communication can be a huge issue, and it can also be changing because of progression in cognitive issues for the patient, which changes the dynamic and how people need to speak to each other and communicate. And also the impact on younger families with children and such related to finances. And again, if someone's a breadwinner and they're no longer able to work, how that impacts everyone. It's a challenging disease for both the patient, but it oftentimes is very, very challenging for the family members also. And care partners have to deal with the fact that they want to be supportive, generally speaking, but sometimes it just gets very, very stressful, and then they have to know how to kind of regroup and reach out for help and ask. The other thing that I've learned is that there's no right or wrong way to communicate per se, and you have to be willing to try out different means of communication and understand that you might not get it right. You will learn very quickly when you're a partner that how you perceive the communication might be different than what the patient actually needs. So you'll have to figure out as a couple how you're going to do that. And there will be lots of mistakes along the way, but that's okay, because you can regroup. And again, as the disease progresses, as the needs change, I think there'll be different types and ways to communicate. In regards to specific examples, as patients develop maybe more cognitive changes, which initially are not terribly noticeable, they oftentimes get confused and they get looked at as deliberate, and that the patient is not listening to their partner, they're not helping, they're not doing their end of the workload, and that can be very, very stressful for families until you sort of put together the cognitive issues. What I tend to do then is, with couples, is I'll refer the patient in for neuropsych testing. And that really helps kind of solidify where the cognitive deficits are, and then have the patient and the care partner work together on different communication techniques and such, and understand that it's not a deliberate act towards them. Their loved one is not doing this on purpose. It really is a challenge. So you always have to, I think that's one of the most difficult pieces of it. The other thing that I see a lot is sort of the struggle with independence. Oftentimes the care partner wants to jump right in there and say, oh, do it this way and do it that way. And we have a lot of concerns always about falls. But what I've learned, even at this meeting today, was that we need to have a tolerance of risk for people. People have to still maintain their independence. They have to be able to do what they think they can do. You have to be there to maybe gently guide them, but I think you need to let the person with MS take the lead, which is hard. And then as a good care partner, hopefully you can support them when they need it, but being able to step back and let them maintain their independence can be a big struggle and a big source of conflict. I think the best thing for care partners to do is to understand that their loved one will communicate, will let them know what they need. I think perhaps it just takes time to learn. If the disease is very progressive, sometimes people don't have a lot of time to learn those skills, but this generally tends to be kind of a slower progressive disease over a lifetime, and hopefully you can practice learning those skills in terms of just letting your loved one do what they seem to be doing, and they'll let you know when they need additional help or not. And sometimes they may have to fall or something may have to happen, hopefully not too seriously, and then you can renegotiate. Well, maybe this would be a better way to do something. I think the other strong skill for a care partner would be to have to develop a little bit of intuitiveness in terms of knowing when the right time is to communicate with your partner about a concern that you see. You can't come across as authoritarian. I mean, you really need to take that step back and make sure that the communication between partners is more equal and not I'm in charge or you're in charge, because that'll never work. You really have to sort of approach it from an equal, like we're partners together and let's see what we can do. And that's hard because it takes time. It's much easier just to say do this, but it takes time to allow that communication to figure out how it's going to work. So, and I think patience is one of the biggest virtues you need to have in dealing with all this. With the new terminology and using the word care partner, I think the emphasis is on partner. Caregiver, I think sometimes sets that role up to be for a burnout situation, because if you're the caregiver, you can only give to a certain point. But if you perhaps present it as a care partner, and it's that way from the get-go, my situation is different in that my partner had MS before I was ever on the scene, so it was there from the beginning. But oftentimes it comes into their relationships after these relationships are established. So just as you partner in a marriage in any way, or partner together, to raise families and such, you can partner you can partner in MS, and that's what you're going to have to do. But yeah, I think it allows both parties to sort of take away the I'm giving and you're receiving, because I don't know that that's always the best approach. I think, again, going back to the independence, patients really want to maintain their independence. So if you partner with them rather than, give them whatever, I just don't think that's such a great approach. Somebody's going to end up not happy in the end, and so I think the care partner term is just it sets the relationship up a little bit better from the beginning. I have an interesting sort of situation in that my spouse had MS from the time he was 16. He was 39 when I married him, so he had MS longer than he had me, and that's still the same in our relationship. So it's always there, and I always have to think about it, but he's been managing this long before I was ever on the scene, so that was probably the hardest thing for me to learn because of the fact that I work in healthcare and I'm a provider. I provide help. My training is as a nurse, and that's what we do. But I have to remind myself that he's had this longer than me, and he'll do fine. I think I'm also lucky in that my work in this area has given me some insight in terms of the cognition and in some ways to do things a little bit better. He still has his own ways of doing things physically, and I disagree with them, but you know what? I thought I can't. It's fine. It's his choice, and until he has to make a different choice, I think we'll stay with that. Just as MS is an individual disease on every patient, it looks different, so is the journey as a partner, as a care partner. There's never a right or wrong way to do it, per se. Some relationships end, and it actually is okay for both of the partners involved. I mean, sometimes people have to come to that decision in terms of maybe a legally binding, but they can still have a relationship. So I think people just need to understand that their role as a care partner may also be incredibly individual, just as the disease is an individual. Just understand that you make mistakes, things can change, have tenacity, find a different way to communicate, find a better way to communicate. You have to keep moving on with it. And again, the disease is fluid, it changes, and you have to learn to change with it, and that's okay. That's exactly what it is. And I think if you can eventually accept that, it takes a lot of angst away and just allows you to just sort of be in the relationship. I just think that's the easiest way to be.